Welcome back to our YouTube channel. Today, we're going to dive into pediatric TBI. Traumatic brain injury is the leading cause of death and disability in children. The national incidence of TBI exceeds that of any other disease in the pediatric population. The CDC reports 697,347 annual TBIs in children who are newly born up to 19 years of age that result in emergency room visits, hospitalization, or deaths, with TBIs being most common among toddlers and adolescents. Here are some of the common causes stratified by age group. For newborns, head compression during delivery or hypoxia with lack of oxygen can increase risks for TBI. Infants have an increased risk of getting TBI if they've had accidents or abusive head trauma. Toddlers tend to have increased pedestrian injuries and accidents due to their developed motor abilities, which can increase risk for TBI. And finally, adolescents who have experienced sports-related injuries and falls have a chance to develop TBI. Pediatric TBI outcomes are wide-ranging and can affect various domains of a child's life, including cognitive growth, social capabilities, and personal or behavioral health. TBIs in children are often described as chronic disease processes rather than acute events, as symptoms are ever-changing, particularly as a child develops. While some children may not experience significant changes to their overall development, others may sustain both short and long-term difficulties, which are particularly noticeable once a child begins attending school. A large percentage report difficulty with schoolwork, behavioral problems, and personality changes. Common outcomes include temper tantrums, mood swings, aggressive behaviors, issues with memory, communication, language, or concentration problems, and mild learning difficulties. TBI outcomes may co-occur with other neurological conditions such as attention deficit or hyperactivity disorder, autism spectrum disorder, and childhood loss of speech. In terms of long-term outcomes, pediatric TBI is associated with an increased risk of impaired adult functioning, psychiatric disorders, low educational attainment, and premature mortality. Common and effective prevention strategies include utilizing child safety belts and seatbelts when a child is inside a motor vehicle, and having the child wear protective gear and a helmet when riding a bicycle or engaging in sports. Screening and assessment efforts require collaboration with family members, medical, rehabilitation, and educational professionals. Speech-language pathologists often conduct screeners for language and cognitive communication deficits among children with TBI, followed by more comprehensive assessments that examine behavioral and emotional factors, as well as sensory deficits. Various approaches are often used in tandem depending on a child's particular needs. Restorative approaches utilize a hierarchical, direct approach to improve or restore impaired cognitive functions through retraining. Habilitative approaches help children learn or improve forthcoming skills or abilities, and are often used when the injury happens before developmental milestones like speech development. Compensatory approaches focus on minimizing the difficulties posed by certain deficits due to TBI. Some examples include implementing accommodations, such as note-takers and extra testing time. Functional, also known as contextualized, approaches use a holistic treatment approach that takes into account the child's and family's personal goals, and often involves improving skills applicable to social, vocational, and educational activities. Overall, when treating pediatric TBI, caring for these children is most effective when both family members and caregivers communicate and work in harmony to play equally active roles in serving and advocating for the child. If you would like to learn more about pediatric TBI, here are some links to learn more about it. They will also be linked below in the description. Thank you for watching this video. Feel free to subscribe to our channel for more brain-related topics.